I lived in that same apartment for 30 years until I was evicted. My savings were depleted, and then I had to go to the homeless shelter about a year and a half ago. I had to stay in parks several times, and that was for a couple months. I did that right after I lost that apartment. But I had trouble at nighttime trying to find a place to sleep.
Friday tends to be our outreach day where we collaborate with this team called SSVF, which is Board of Services for Veterans and Families that work under VA funding too, for housing veterans, and then our own VA internal housing outreach specialists. And we go to one of the resource centers to look for some of the people that are unhoused that we know that we're looking for, and maybe meet some other ones that haven't even been enrolled in VA healthcare, to try to get them engaged.
Our older veterans are definitely a big source of concern for us because of the rising cost of home health care, hospice care, and just medical care in general, the rising costs of housing, the rising cost of food. It's so much more difficult for them to connect with these important services. And our older veterans, we're seeing a rise in that age group because we're getting our Vietnam veterans who are starting to come in at a larger rate. So definitely having HPACT there to come in and support them, and the mobile medical unit, which is able to go and meet them where they're at, has been such a gift and such a blessing.
So our goal for the mobile medical unit is to get about 2 people per day, 500 for the year, I believe it was. And so on the past few months, we've been really on track to do that, which is awesome. We've been taking it to places where we can really try to get a bunch of people in one place. And so resource centers are a good place for that, commonly called shelters. Nice big breath. Oh man, we do everything. We've got, regular vital sign machine in there. I can basically do everything that I can do in a clinic visit on campus here in the mobile unit. So we've also got the ability to draw blood, which is pretty cool, and then also give vaccines and order anything. So I have an iPad, it's connected to our network, and I have a VA cell phone, and technology is amazing. So I order everything on the spot, and sometimes we even transport patients back after visits if they can't make it to where they need to be, to go to like an ultrasound appointment or a specialist appointment, and help them schedule that and everything too. So we're kind of a one-stop shop. I've got snack bags on there too. Our food hub is amazing, and they provide us with snack kits for people, and sometimes we take full food bags on from the pantry for people. So we kind of get it all done. The nurse and I are on there, and then when we need a social worker in addition, we'll usually go out and find one to come on.
The mobile clinic is huge, and I actually am a huge advocate for it because it's something that comes to them. When you're in this situation, a lot of people, you may not have a car, you may not have access to transportation. The mobile clinic coming to our clients is some of the best help that could be out there available for them because of that lack of transportation, lack of resources they may not have. So with more mobile clinics, we're able to outsource and outreach more people that need our help. And I really think that's a great thing.
I think a lot of veterans that we see have typically come across a lot of barriers to getting the care that they need. In the community, in the VA, there's just a lot of runaround sometimes, and it's really complex and difficult to be able to do all of that without a phone and without transportation often, and without a place to live. So they're really grateful. I mean, the rapport that we build just by giving them a hygiene kit or giving them a snack bag or a bag of food is really kind of beyond, I think, most of what they would have expected for that day. And it helps kind of set the stage for us to be able to engage with them in their medical care down the road for years, and getting everything done. Like, that's usually just the first step in being able to offer them something like that.
When the van comes around, it helps me a lot. It's mobile, and so I don't have to go to the hospital, VA hospital. And I like that every month or so, they'll be checking my health. For the future, that's good for me.